Welcome to this very important training. I'm confident that after this training, you will have an easier time performing your job, particularly when dealing with clients who have experienced trauma in their lives. Let me tell you a little bit about myself. I'm a social worker, and I have been working with the elderly for the past 30 years. Most of those years I spent working in nursing homes. This is one of them. For the past few years, I have been working with a very special population. I've been working with Holocaust survivors in the community. Can I see a raise of hands if you know what a Holocaust survivor is? And if you've heard the term Holocaust? Okay, so let me explain. The Holocaust refers to the extermination of 6 million Jews during the Nazi era from 1933 to 1945. Let's consider what 6 million is. That's 3/4 of the population of New York City, and it was 2/3 of the Jewish population of Europe. It began with the rise of the Nazi government in Germany, and it grew to affect 30 countries in Europe, North Africa, and the Soviet Union, all of which were invaded by Germany and its allies during World War II, and it ended with Germany's defeat in 1945. In 1933, when it began, about 9.5 million Jewish people lived in Europe. By 1945, about 3.5 Jewish people remained, 1 out of every 3 who were alive before Nazi persecution. That means that 2 out of every 3 Jews were murdered by the Nazis. Holocaust survivors are elderly Jewish men and women of European descent who managed to survive this period of history but were persecuted terribly. People who survived the Holocaust have been through horrific experiences that have affected them in many different ways. Today we'll be learning about some of the things they may have been through, how that may have affected them, and how you can respond in a helpful and sensitive way as a caregiver. Your kindness can make an important difference in an older person's life. In most situations and in most relationships, we know it's the small things in life that matter most, the caring and thoughtful gestures from one human being to another. You can make your moments with your residents special by paying attention to the most needy ones and trying to figure out how you can help them. Doing that will make your job incredibly rewarding. Working with Holocaust survivors or other trauma survivors and learning about their unique needs is a wonderful opportunity to put this into practice. Let's talk a little bit about survivors' experiences. Most Holocaust survivors lost their entire families who were murdered by the Nazis. Each survivor suffered major trauma, and each survivor had their own individual experiences of survival. Some were witness to their parents' and siblings' death, some were hiding during the war, and some escaped from unimaginable circumstances, but each and every one experienced trauma. The trauma of losing their family, their homes, and having to flee their towns and countries to start a new life elsewhere. These survivors had to bury the memories of their trauma in order to begin new lives. The trauma was so severe that they couldn't even think about it, and the emotional pain was too much to deal with at that time. Only as they aged, the survivors began telling their stories. In today's training, we're going to be talking about trauma, particularly the trauma that Holocaust survivors have experienced. We'll also be talking about a way to help traumatized survivors that recognize what they've been through and the needs that their experiences create. This method is called Person-Centered Trauma-Informed Care, or PCTI, and I'll be explaining a little bit about that. In the meantime, we'll start with some background on the survivors and what they may have been through. Trauma affects Holocaust survivors in particular ways. Understanding them will help you to better care for them. In order to properly address their particular needs, you first need to understand what they may have experienced during the war. Then you can understand why they may have strong reactions to different situations. The Holocaust took place over 12 years. It began when Hitler rose to power in 1933. He created strict laws against Jews, which made it difficult for them to go to work or to school. When the Nazis took over Poland in 1939, Jews had to leave their homes and move to small, closed-in neighborhoods called ghettos. Then in 1941, Germany invaded Russia, and the Jews in the ghettos were either murdered or deported to concentration camps, where they were either killed immediately or forced into slave labor. If you're working with a survivor, that survivor may be someone who was forced to live in a ghetto under inhumane circumstances. Ghettos were overcrowded and isolated from the rest of the population, and their inhabitants were not allowed to leave. The Nazis were guarding the ghetto walls and the gates. There was poverty, starvation, disease, and beatings by the Nazis. Or the survivor may have lived in a concentration camp during the war, a prison camp where they were forced to work hard all day with very little food and could be killed at any moment. Or the survivor may have survived the war by staying hidden, which was also terribly frightened because they could be discovered and killed at any moment. All of the remaining survivors who are alive today were only young children when they experienced the horrors of the Holocaust that I have just described. This is a child survivor being rescued at the end of the war. And if you do the math in your head, you know that it was 70 years ago, so any survivors that were alive today were young. The oldest could have been teenagers when this happened. As survivors age, there are changes in their mental health. When a person retires from a lifelong job or a lifelong role, they have more time to reflect. As their short-term memory decreases, their long-term memory increases. Memory loss and other age-related changes may contribute to flashbacks of traumatic memories. More frequent naps mean more unpleasant dreams. Many survivors avoid sleeping to avoid nightmares, and they doze off more frequently during the day because they're not sleeping well at night. Aging is uncharted territory for many survivors because their relatives were killed and they weren't around for the survivors to observe the aging process. If you have an elderly grandparent living in the house, we see firsthand the changes in them as they age. Working in a nursing home, we see firsthand how debilitating it is as a person ages. But these survivors didn't have their family around to observe this firsthand. And they may not know what to expect as they get older, and they may have trouble adjusting to the changes they experience. Having talked a little bit about the Holocaust itself and how it interacts with the aging process, I'd like to talk a little bit about trauma and how it affects people. This training can also be applied to survivors of other trauma as well. Some examples are violence, fire, a war, domestic abuse, physical or sexual abuse, or others. If you feel comfortable, raise your hand if you know someone who has experienced a major trauma in their life. Okay, I understand if you don't want to share, but if anybody does know someone, they know firsthand how traumatic it is, and the trauma never goes away. Maybe it lessens for some time, or if somebody goes for therapy, but as a person ages and they have time to think, that's what comes back. The trauma comes back to them. So let me explain a little bit more about trauma. We've been using the word trauma, and I'd like to give it a precise definition. Trauma is a deeply distressing or disturbing experience. I want to talk a little bit about how trauma changes people. Picture yourself crossing the street, and suddenly a car comes barreling toward you at top speed. It doesn't look like the driver sees you or is going to slow down to stop himself from hitting you. What happens in that case is your brain sees that you're in danger, and it gets your body ready to react. What does your body do as it prepares to respond? Let's think about what that feels like. Your heart beats fast, your muscles tense, your breathing is shallow, and every ounce of energy in your brain is keeping you super focused on every detail of what's going on around you. We describe that reaction as fight or flight. The brain has to decide whether you're going to stay to fight, to defend yourself, or run away. In the case of the car, you'll most likely run away. After the threat passes, your body will probably turn to normal. When someone goes through an ongoing trauma like the Holocaust, their system goes into a constant state of fight or flight. Think about what that might be like. What makes it even worse is that there's no sign that it will ever end. It's one thing when we go to the doctor or the dentist from something painful and we know it will be over in a few minutes. It's another thing when something terrible seems like it could go on forever. For people who go through an experience like the Holocaust, everything begins to look like a scary threat. It's overwhelming, and it's physically and emotionally exhausting. Some of them can't ever feel safe and are always on the lookout for the next threat. Anything that reminds them of their experience may feel like a threat, and they may respond as if they're being threatened. These reminders of traumatic experiences are called triggers. Although I've just described what happens to people who go through trauma in general, it's important to remember that traumatic experiences and reactions to traumatic experiences are different for each and every person. Just like we have individualized care plans for the residents, each individual reacts to trauma differently. There is no one-size-fits-all approach to trauma survivors. No two trauma survivors are the same, and no two Holocaust survivors are the same. Different survivors may be triggered by different experiences, and it's important to treat them as individuals. Understanding that each individual is unique and each survivor had their own experience led to the development of PCTI, Person-Centered Trauma-Informed Care. The goal of person-centered trauma-informed care is to individualize our approach and care for each individual based on their particular needs. PCTI is a holistic approach that promotes the dignity, strength, and empowerment of trauma victims by incorporating knowledge about trauma into agency programs, policies, and procedures. That's one of the reasons I'm here today. Medicare and Medicaid has dictated that nursing homes and hospitals incorporate trauma training into their programs so that the staff can properly care for trauma victims. As nursing and rehab staff, you're familiar with individualized care plans. You need to care for each resident based upon their unique medical, physical, and emotional needs. PCTI takes it one step further by understanding and recognizing the unique emotional sensitivities of trauma survivors. We can better care for them. On a practical level, what does all of this mean? When caring for aging Holocaust survivors, a one-size-fits-all approach will never work. Each individual has their own needs, their own history, their own trauma-related past, and their own triggers. We need to know the individual on a one-to-one basis and get to understand his or her fears, sensitivities, coping skills, strengths, and weaknesses. When getting to know a new resident, we need to understand their history. An important part of obtaining their personal history is gaining an understanding of the client's willingness to relate their history. Some clients like to talk about their experiences during the Holocaust, as it may be therapeutic for them, or they may feel a moral obligation to relay it to the next generation. Many Holocaust survivors resist talking about their history because it brings up painful memories that they have buried in their subconscious minds in an effort to avoid the triggers associated with these extremely painful memories. It is important to proceed slowly and gently when questioning new residents. Whenever possible, try to get as much information as you can from relatives to minimize the amount of questions that you ask the resident. A relative is a step removed from the trauma and can talk about it more easily. Remember, you don't need to get all of the information at one time. You can get it gradually over a period of time. Once you know a client's history, you will be better prepared to provide care for them and to develop an individualized care plan. Whenever possible, it's important to involve the resident and their family in developing their plan of care. Knowledge is the most important ingredient in developing a comprehensive and individualized care plan for your client. When you know and understand your resident really well, it will be easy to create a care plan that addresses their individual needs. As you know, if you have a long-term resident that you know really well, you go to sit down to write their care plan, it's very easy because you know them really well. When a new resident comes in, it takes time to get to know them and develop a proper care plan for them. We all know that living in a nursing and rehab center is never the first choice for anyone. Residents and their families make this important decision based upon the individual's medical and personal care needs. When transitioning to a long-term or short-term placement, such as a nursing and rehab center, we need to be aware of major triggers that will inevitably occur just by living in an institutional setting. Just by being admitted to an institutional setting, that may trigger painful memories. Medical staff in uniforms, loss of independence, being on a schedule not of their own choice, being dressed or showered by a stranger, and many more. These are all major challenges for anyone being admitted to a facility, but it is even more difficult for Holocaust survivors to adjust. Survivors may be entering a facility because of a physical deterioration, a debilitating disease, a medical event, a surgery, or after a hospitalization. Getting older and losing your ability to do things is difficult and painful for anyone, but physical weakness and illness can actually be triggering for a survivor. During the war, and especially in concentration camps, any signs of physical weakness could lead to separation from the group, which would ultimately lead to them being killed by the Nazis. In the concentration camps, the ill and the elderly were immediately sent to the gas chambers, where they were disrobed and forced into the gas chambers. Instead of water for showers, poisonous gas came out, and they all suffocated and died. The very reality of growing old may trigger fears and anxieties among survivors for these very reasons. In fact, it's important to be aware that a survivor might not be totally honest with you about their symptoms, and they may be suffering more than you realize. Anyone moving into a facility needs to adjust to having less control over their decisions, even when it comes to their daily routine. This would be hard for anyone, but for a survivor, that is someone who has suffered especially painfully in the past at having others control their lives down to the smallest details. It's important to be aware of how difficult this must be for them, especially having to readjust to this after having lived independently for a very long time. There are many different experiences in an institutional setting, such as a rehab, which may trigger strong emotional responses in a survivor of trauma. There are some other triggers that are common to many survivors: showering, new and unfamiliar faces, staff in uniforms, loud noises, or scary-looking medical equipment or rehab equipment. These and other everyday aspects of facility life can be frightening for a survivor. The more aware a staff member is of this beforehand, the better they can plan for helping the survivors through these experiences. Eating is a major issue for Holocaust survivors. As I'm sure you're aware, there was a serious shortage of food during the war. Whatever rations people received during the Holocaust, they always put some away for later, not knowing when their next meal would be. Jews during the Holocaust were always hungry and were fearful of not having enough food for the next meal. Today, Holocaust survivors may feel driven to collect food. Hoarding is very common among survivors. A survivor may also refuse to eat or overeat. We need to be aware of and look out for these behaviors and be prepared to address them appropriately. Sleeping is a major issue for Holocaust survivors and trauma victims. They suffer from nightmares and flashbacks, and this leads to a fear of sleeping. They don't sleep well at night and frequently nap during the day. It's very important to understand the resident who is a survivor. With the help of their family and friends, you can learn about the survivor's particular trauma and potential triggers. This knowledge will help you to anticipate potential triggers so that you can try to avoid as many as possible while helping the survivors to cope with any triggers that are unavoidable. Holocaust survivors and trauma victims are often frightened of new faces and new experiences. Uniforms can be particularly triggering as reminders of the Nazis who abused and terrified the survivors. During the Holocaust, the Jews were led to gas chambers under the guise of showers. Imagine yourself not being able to shower independently due to physical disabilities or mental illness. As challenging as it is for us to be showered by a complete stranger, multiply that 1,000 times for a Holocaust survivor. Just the word shower has negative connotations, and to be disrobed and showered by a stranger in uniform is even more traumatic. Loud noises, such as a fire alarm or electrical equipment, may startle survivors, and many survivors have a strong fear of dogs. The Nazis used dogs, particularly German shepherds, to search for the Jews who were in hiding. So while pet therapy is usually considered to be comforting to most residents, it may not be for a survivor. Knowing in advance what may be a trigger for survivors of trauma will help you to help them to prepare for it. By planning ahead, you can reduce stress for the survivors and for yourself. When it comes to planning for expected triggers or dealing with unexpected ones, always think out of the box. When you get to a brick wall, there's always a way around it. You can climb over the wall, you can go around it, You can chisel your way through it or dig under it. Where there's a will, there is a way. When you focus on problem solving, you will come up with creative solutions. Just don't give up. Understanding your resident will create a positive relationship with them. Get to know their family, their lives, and their history. The resident will trust you more as they get to know you more. Reach for the person and try to get past the baggage and the negative experiences. You can distract them from focusing on sad or negative thoughts by engaging them in conversation. As you're getting to know the survivor, one thing to be aware of is that survivors may not know their family medical history because their relatives didn't survive the war and there was no one to ask. This is something to remember to be sensitive about and to remind medical staff when doing an intake of a new client. During the initial interview, instead of asking, "What is your family medical history?" try asking, "Do you know your family medical history?" And this gives the survivor the opportunity to respond with a simple no if they don't know it, instead of them having to explain why they don't know their medical history, and that may trigger a strong emotional response. This is one example of knowing in advance that something might be a trigger for a survivor and planning accordingly. Whenever you can, prepare in advance. It will make your job easier and a more pleasant and less stressful experience for the survivor. Information will go a long way in preventing stress for a new resident. Take the time to explain things before it happens. Knowing that Holocaust survivors and trauma victims have a fear of new faces and new experiences, take them on a tour of their floor. Show them the shower room prior to their scheduled shower. Take them around the rehab room to show them the different types of equipment being used and so that they can see other residents using it. Information will go a long way in preventing stress in a new resident. Take the time to explain things before it happens. If you know in advance, you can tell them when a fire drill will occur. If maintenance has to do something on their floor that will involve loud machinery, try to take the resident to rehab or an activity on another floor during that time. If you know that showering is an issue for them, here are a few tips that may help showering be less challenging. Disrobe the resident in the shower room, not in their room. This way, they can see the physical shower room beforehand and not have to imagine what it looks like. This is especially relevant for Holocaust survivors and for dementia patients. Respect their privacy and bring a change of clothing to the shower room, if at all possible, so that they can be dressed before proceeding back to their room. Minimize the number of staff present during a shower, and if necessary, have a family member present to keep them calm. If you have a resident who is not eating enough and is then putting away half their meal for later, plan for it. Put an extra piece of bread, a sandwich, or fruit on their tray so that they can save that for later. Then encourage them to consume the rest of the contents of their tray. If it's someone who needs assistance to eat, try to encourage a family member to be present. If that's not possible, try to assign a regular staff member to help this person eat. A familiar face will be a calming influence on the resident. During a pet therapy session, if you notice a survivor is uncomfortable with dogs, remove them from the room and engage them in a different activity. Relating kindly to a survivor will make your job easier. Let's walk through a typical day for a newly admitted resident. Let's pick Mrs. Schwartz. She was admitted yesterday afternoon. She met the 3 to 7 staff, the charge nurse, the CNA, maybe the dietitian and her social worker. Overnight, if she needed anything, it was a different CNA. And now at 8 o'clock in the morning, it's a third CNA that she is meeting within less than 24 hours. The 7 to 3 charge nurse comes in to meet her and asks a lot of the same questions that were asked yesterday when she was admitted. My favorite interaction when I worked with residents was I was asking reality testing, and you ask, do you know who is the President of the United States? And one lady said, who the heck cares who is the President of the United States? Could you just please bring me my pain medicine? At some point, someone from rehab comes to meet Mrs. Schwartz. By the time she has gotten out of bed, she has met at least 8 to 10 staff members, and she probably doesn't remember their names or their job titles. And to her, they're all wearing the same uniform, a white lab coat, or I guess now you're wearing navy, whatever color it is. So the first thing you need to remember is to introduce yourself by name and job title the first few times you meet a new resident. The next thing is to explain the purpose of your visit and what you will be doing before you do it. For example, "Hi, Mrs. Schwartz, I'm going to take you to the elevator now so we could go upstairs to rehab to do some exercises." One complaint I had from a gentleman I worked with was he said he was wheelchair bound. "I feel like a piece of furniture. They move me here, they move me there. Sometimes they come up behind me, they start moving with me without even telling me." So remember to ask before you move them. Of course, if a resident is particularly sad or crying, you will talk to them about what's bothering them, and you will refer them to the social worker or psychologist. But if it's ongoing behavior, try to engage them in positive discussions. Be careful when discussing news events, and in particular, if they're about violence. Try to focus on positive news or humorous or uplifting anecdotes. I even wrote in the handout, you could even tell them what happened to you on your way to work that day. You can turn anything into something funny, and it will distract them. The most important thing you can do for a survivor is to take the time to talk to them. Having worked in a nursing home, I understand the pressure of time and scheduling that you're under. I know it's even hard to come to this in-service, particularly the nursing staff and CNAs. You work under a very regimented schedule. You need to wake the residents, dress them, feed them, and get them to rehab and activities on time. But when you come across a resistant resident, what works best in your experience? Coaxing or pressuring them to do what you need them to do, or taking the time to talk to them and understand what is bothering them and holding them back? The more positive a relationship you can form with a survivor, the easier it will be to help them get through situations that will otherwise be very challenging for you. Taking the extra time initially will save you time in the long run. Okay, I've talked a lot about the residents. Now let's talk about you. As a caregiver, your job is to focus on the resident. But an important thing to remember is to take breaks and to care for yourself as well. In the handout, I have reminders to take care of yourself. And let me just take this time to remind everybody to please silence their cell phones. If you're feeling overwhelmed or you're not feeling well, you won't be an effective caregiver. Self-care is very important. An example I like to give is the oxygen mask on the plane. You know the demonstration that the stewardesses perform before you take off? And nobody pays attention anymore, so they started doing it in rhyme and song and making it humorous, so we should pay attention. So if you've paid attention, who are you supposed to put the oxygen mask on first, yourself or the person sitting next to you? Always yourself. It doesn't matter if it's your infant baby sitting next to you or your elderly mother. You have to take care of yourself first so that you can be there for them. If you don't, you'll become too weak and you won't be able to help them in the emergency. So by putting the mask on yourself, you enable yourself to be strong, and by taking care of yourself as a caregiver, you will be a more effective caregiver for all your residents. It's very important to give yourself time to recharge your batteries so you can feel refreshed and energetic when you care for your residents. If things are getting too much or stressful and you find yourself tempted to snap at a resident, it's a good idea to go outside for some fresh air if you can. If that's not possible, then ask if someone else can cover for you. If that's not possible, see if you can come back to this resident later and go to a different one at this time. If taking a break isn't an option, which sometimes it's really not, count to 10, take a deep breath, and brainstorm ideas that will distract and calm down your resident. Keep in mind some of the ideas that I've discussed today so you will be ready to use them. If you find yourself losing patience with a challenging resident, try humor, maybe a compliment, or just distract them from whatever's bothering them. Caregiving is emotionally draining work. Don't keep things bottled up if something is troubling you about your job. Make sure you find a sympathetic person who can help you problem solve, maybe a colleague or a supervisor at work or a wise friend or relative. When you are a caregiver, remember to take care of yourself first. You need proper sleep, nutrition, and exercise, as well as free time to enjoy your favorite activities. This will enable you to be healthy, strong, and refreshed so you can perform your job properly and with the right frame of mind to be patient and caring to your residents. Does anyone have any questions or comments? Okay, so thank you for attending this very important training. I hope it will help you to do your job better. And if you can pass up the evaluations, and I want to make sure everybody signed in. If you didn't sign in, it doesn't count. So where's the sign-in, the clipboard? Oh, perfect, thank you.